Hi, my name is Crystal Hurtado. My topic is about the Cochlear implementation is the adult. Definition Cochlear implants are the aperture for adults with the moderate to the peripheral sensorial hearing. The loss in the voice ear was rough, not the revenge. I know benefits when the user hearing aid.
Able to use a hearing aid, for the next 20 years. Finally, the hearing aids just didn't help me anymore. I couldn't hear the grandchildren, and they would be talking, and I could hear them, but I could not understand them.
As time went on and it got worse, the hearing aids weren't working, and it just got, very, very frustrating. And for her, it was even worse. If you can imagine living in a bubble and not knowing what's going on and who's talking and not being able to hear your children and grandchildren, and it just was kind of sad. She's always been a very social person, and she kind of started withdrawing from her activities.
Typically, when we say that your hearing has progressed to a point where you have a severe to profound hearing loss, basically even with the loudest sounds you're having some trouble making it out sometimes, as well as your speech scores getting to the point where even with a hearing aid, you're understanding less than half the words spoken to. That's typically the level at which people reach criteria for a cochlear implantation. The main thing that happens is really that the inner ear has been damaged over time. The cells in the ear can't regenerate over time. So the inner ear is no longer as able to take.
Application and nursing. The study answered the outcome of the conclusion in place in the addition to the hearing aid.
We only placed them in adults who had acquired their hearing loss later in life.
I had normal hearing as a child, and I didn't really notice a hearing loss until I was in my late 20s. Finally, the hearing aids no longer helped me, and the audiologist that I had been with for years told me, you might consider a cochlear implant.
It is because those adults already have in their brain the language abilities and the hearing abilities that they've acquired over their lifetime that we can truly determine what it is a cochlear implant is able to accomplish. And even to this day, the most ideal and most simplest to acquire good hearing with a cochlear implant are our adults.
Every time I would get a new hearing aid, I would get so hopeful that the new technology would give me some clarity, because I could hear the sounds. The hearing aids amplify everything, but I couldn't understand. Until after I had the surgery, I didn't realize really how depressing.
Pros. The conclusion implies in the functionally dry ear.
Traditionally, the activation of the cochlear implant happens approximately 1 month following surgery. The surgery takes place immediately behind your ear, and so we need that time to let your ear heal so that when we place the external equipment behind your ear, there isn't any additional discomfort. The activation sessions are the initial stimulation of your ear electrically. The very first day, what we primarily concern ourselves with is loudness tolerance. The first thing your brain decodes as part of a sound package is the loudness of that sound. And so that's the first thing we need to deal with. For a lot of patients, that ear has not been stimulated in a very long time. And for all patients, it hasn't been stimulated for at least a month. So when we first turn the electrical stimulation on, it can be very much like a bright light in the middle of the night. And your ear needs a certain amount of time to take in that information, get used to it, tolerate it, and then be ready to move on to something else. The follow-up activations after the first one are making those adjustments so that your ear.
Applied in Ecuador, the study demonstrates the facial are able to the social
And many of
proof.
them would say it's given them their life back again.
I would feel so comfortable to send anyone that was considering it at all to Dr. Peters. It was just incredible. This has been a total miracle in my life.
Conclusion: the clinical aspect and the implantation of the hearing loss is the
which is understandable. It's still general surgery. It's still a surgery, and but given the relatively sort of small nature of this procedure, most people are surprised of how well the recovery is going when we meet them back a week after surgery. So it's generally the tenor is that people said, well, this wasn't a big deal.
Amen to that.
Sweated it out.
My surgeon said with what he was going to do with me, he has incurred none of those complications. None. He's done over 1,000 of these. So the odds of something going wrong for me seemed very low and very acceptable.
If you'll have a seat.
So first, when patients have this hearing loss, and they're usually referred to us by an outside, either audiologist or ENT, or even their primary care doctor, we use a hearing aid to test the patient's hearing at that time. And that will really tell us the best aided condition, we call that, which of course reflects the patient's hearing with his or her hearing aids. And that aided speech testing or aided hearing testing will really tell us whether someone's a candidate or not. Once that's complete, there is also a medical evaluation process. We just make sure that the middle ears are okay, that the patient has no other medical conditions that would preclude cochlear implantation. And we typically do obtain a CT scan, in some cases an MRI. You can see the hammer bone, the amble bone.
So it will sit behind your ear, just like that.
Okay.
And then it will communicate to the inside piece via that magnet.
The surgery requires general anesthesia. It takes about an hour and a half to do the procedure, or sometimes even less. It requires a cut behind the ear. It's about a 2-inch cut behind the ear, or 5-centimeter cut behind the ear. And overall, it's a very safe procedure. We do really consider general health, of course, as a factor in all this. But typically speaking, there is no upper age limit for cochlear implantation. And compared with hip replacement, I would argue that cochlear implantation